Hello, I'm Beth Lowe. I am a registered dietitian and I teach in the Department of Allied Health Sciences, teaching a lot of the nutrition courses for ETSU. And I am also the program director for the undergraduate program in dietetics. So today I was wanting to speak with you about the requirements for admission to the program in dietetics. What are some of the jobs that you can get? What are the courses that are required? And just tell you a little bit about the program in general. A lot of times folks who, when they're in high school, they or in their early college years, nutrition is just not something they want to think about as far as eating healthy and being healthy and that sort of thing. It's just not that much of a fun thing to think about. So there's not a lot of thought given to nutrition and dietetics as far as the healthcare field or the healthcare team is concerned. But in reality, the healthcare team relies heavily on the registered dietitian to make all of the nutrition decisions for the patients. And as far as the healthcare team, the RD or registered dietitian is the only one on the healthcare team who's making those decisions and basically calling the shots and making recommendations as far as diet orders and tube feedings and that sort of thing for the patients. So it's a very critical position on the healthcare team, and that's what the undergraduate program in dietetics does. It prepares students to become registered dietitians and to be part of that healthcare team. Now there's a lot of different job opportunities or venues where the RD can be employed. The majority of RDs in the country are employed in hospital settings. Most all of them in healthcare settings. Some of them are more in wellness and sports nutrition and that sort of thing, but primarily in healthcare settings, hospitals being the primary employer. So of course most hospitals would employ numerous dietitians, and they would all have various functions within the hospital to see patients and to make the decisions regarding their nutritional status, nutrition interventions, what kind of nutrition care is going to be provided for the patient, and that sort of thing. In addition to hospitals, there's also registered dietitians in every health department in the country. So all of the health departments, public health and community health type settings would employ the RD. Also outpatient clinics. There's more and more healthcare going on in the outpatient setting, getting patients out of the hospital and then taking care of them as far as education and that sort of thing in an outpatient setting. So RDs are often employed in diabetes education programs or clinics, pregnancy clinics or outpatient clinics for pregnant moms, maybe even weight management clinics. There's more and more of that with childhood obesity and adult obesity as well. There's a lot of outpatient clinics that are employing the dietitian also. Another area that is going to be a huge growth area in the near future is long-term care or nursing homes, also retirement homes, assisted or retirement centers and assisted living facilities and that sort of thing. But all of those require the services of a registered dietitian as well. Many schools do. Most schools require an RD to have input on the menus. And then there's also the private practice side of nutrition and dietetics, which more and more people are going into in sort of a community setting. Some of those would be for nutrition counseling, where anyone can go to the nutritionist or the dietitian for counseling or consulting. Also, sports nutrition is becoming kind of an up-and-coming field. Professional teams, college teams, and then just individual athletes who want information or education about their athletic, their nutrition requirements for athletics or for their sport. So there are many, many, many opportunities and all kinds of diverse opportunities for the registered dietitian. Now, in thinking about the program here at ETSU, the undergraduate program in dietetics is basically the same number of hours and the same length and that sort of thing as most of the other programs in the university. It's 120 credit hours. so it can be completed easily in 4 years. There is an admission requirement, so students have to apply to be accepted. There is selective admissions. The admission process is based, as it is in any of the other allied health science programs, is based on academic performance and the interview. So the academic performance, or your grades in some of the key classes, is going to be very, very critical. The very first thing, of course, though, is that the student has to be admitted to the university. So whether it's a transfer student coming to us from a community college or from another university, or if it's a newly admitted freshman, for instance, they have to be admitted to the university. In the spring semester of their second year, usually their sophomore year, they would apply for admission to the dietetics program or the nutrition program. The application is found online, and it basically lists the courses. There's some demographic information, of course, that has to be filled out first, and then the overall GPA, as well as the specific grade that has been earned in the courses that we want to examine. So the courses that are required before a student can apply to the program are the probability and statistics in the math department, Principles of Nutrition, which is one of our courses, Principles of Nutrition Science, Introductory Nutrition, which is also one of our courses, and then there's 2 semesters of 2 different science classes. So one is General Chemistry, so it would be General Chemistry 1 and General Chemistry 2, and then also Anatomy and Physiology 1 and Anatomy and Physiology 2. These 4 sciences, 2 semesters of chemistry and 2 semesters of anatomy and physiology, are required in order for the student to apply to the program and be admitted to the program. Performance in these classes is really, really important. You want to pay very close attention to the grades in your science classes, because this is very much what we evaluate your application from. We're looking at how well you perform in those classes, and if you have to repeat it, if you've had a bad semester and you have to repeat a class, that is understandable as well. But both the grades will be averaged in on the application review. Now, when you look at the overall curriculum, which is in the catalog, is online, and on one of the slides as well, you will see that the entire dietetics curriculum is very, very science-based. So when you look at that, you're seeing that there's a whole year of general chemistry, a whole year of anatomy and physiology, 1 semester of organic chemistry, 1 semester of microbiology, and 1 semester of nutritional biochemistry. So it is very science-based. It's very similar to a pre-med curriculum. In fact, there's just a couple of courses that are different from the pre-med curriculum. So being a science person is a real important factor with this process, because that is so much of what we rely on in our professional life. We have to know what all is going on inside the body at the cellular level, what happens to the food once it's consumed and eaten, digested, absorbed, metabolized, utilized throughout the body in different cellular pathways and that sort of thing. So having a complete understanding of the physiological processes that are going on, the anatomical parts of the body, the biochemistry that's occurring at the cellular level, all of these are important features. So we do look at those courses very, very closely. We also want you to have taken the Allied Health course that you're in now, of course, the Allied Health 1010, as well as the Allied Health Patient Care and Assessment, which is Allied Health 2020. So those 2 courses also are very critical for us. Now, as far as staying in the program, once you're admitted to the program, it would be real critical to keep your grades up at a 2.5, 2.75 average for your GPA in order to stay in the program and be able to progress. We will be examining the performance of the students each semester after that, and track or map their performance in all of the classes. Once the students get into the 3,000 and 4,000 level classes, those are the ones that are in the major. So once they're in the nutrition and dietetics courses at the 3,000 level or the 4,000 level, these are the ones that are considered the professional level courses. And they're going to be real critical as far as going on to the internship level. Now, I must explain here also that when a student finishes the undergraduate program in dietetics, they are not eligible to become a registered dietitian at that point. So the next level is the dietetic internship program. Many of the undergraduate programs at ETSU have the internship or the clinical experiences built into the undergraduate program. Dietetics is different. It's more like speech therapy or physical therapy or audiology or something like that, where there's a huge internship component following the undergraduate program at the graduate level. So at ETSU, the way the program is set up, and this is true in any program in the country, the undergraduate program in nutrition and dietetics is 4 years. It's 8 semesters, it's 120 hours, it's a 4-year undergraduate program. The students get their BS degree. Now, once that is completed, there is an application process for the dietetic internship program. The internship program consists of 1,200 hours. At ETSU, it's offered in combination with a graduate program with the Master's in Clinical Nutrition. So, and that's the way it is in many, many programs around the country. There's about 250 internship programs in the country, and students can apply to any of those if they want to. So after they finish their BS degree and want to go on and become a registered dietitian, then they apply to internship programs wherever they want to be. Like I said, the program here is combined with the master's program, so in a 2-year program, the student would complete the requirements for the master's degree and the 1,200-hour internship program. The internship program covers 2 semesters, basically. So the students are in clinical rotations and community rotations, management rotations, that sort of thing, for 2 semesters. So it's a full-time program. It's 32 hours a week for the fall semester of their second year of the master's program, and then it's 40 hours a week for the spring semester of the internship program. So it's a very intensive program. There's not time for part-time jobs. It's very, very intensive, very time-intensive, very thought-intensive. A lot of critical thinking skills are going into it as well. So it's important to keep that in mind, that the 4-year degree does not prepare a student for the licensing exam. They are not ready to become a registered dietitian at that point. They must go on to the next level. Some programs in the country, some internship programs, are not offered in a university setting, so they are not combined with a master's program. There's programs like this in Murfreesboro, Tennessee, and in Nashville, Tennessee. These are affiliated with a hospital setting, and so the student does not have to be enrolled in a university. They just do the internship program. So you can see that there's 2 or 3 different options for getting the internship program and being ready for the licensing exam. But once the internship program is completed, whether it's a master's requiring program or whether it's a hospital-based internship program, either one. Once that internship program is completed, then the student is ready for the licensing exam to become a registered dietitian. And at that point, then, once they pass that exam, then they are eligible for all of the jobs on the healthcare team that I was speaking about earlier. And when you think about all of the different positions in a hospital setting that a dietitian could work in, they might work with cardiac patients, folks that have heart disease or maybe have just had a heart attack, and they'd be working with them on preventing another heart attack, doing things better as far as their cholesterol and their lipid levels and that sort of thing to prevent a future heart attack and to heal well following their heart surgery or something. They might also work with patients that are in an intensive care setting that have had either some sort of a trauma or they're extremely ill and they may be on tube feedings, either enteral or parenteral tube feedings, and so we would make all of those adjustments and work with the patients very closely on the proper nutrients that they need to have in the tube feeding, which tube feedings are best and how much and how often and all that sort of thing. And some patients, of course, go home with tube feedings, and so we would monitor them in the outpatient setting as well. A lot of our dietitians are also employed working in cancer treatment centers or working with cancer patients in an inpatient setting, either one. So whether it's cancer treatment on an outpatient basis or inpatient, there is a great demand for those because of the complications that arise with cancer patients regarding food intake and that sort of thing. Another popular area for dietitians to work in is pediatrics and neonatology. And in all hospitals that have pediatric units or neonatal intensive care units, there's always an RD that works directly with those patients. Those are very, very high-risk patients, and so there's usually a dedicated person just to that team. Another area, of course, is surgical patients. They have tremendous nutritional needs, and so we work very closely with all types of different surgical patients because so much of that surgery could involve the GI tract or something that would highly impact their nutritional status or their ability to eat. Another area would be kidney disease or renal disease. Patients with kidney failure or kidney disease have tremendously different nutritional needs, nutritional issues that they have to battle, and so we would work very closely with those. In addition to, of course, the folks that have diabetes, that are obese, need weight management, and that sort of thing. Eating disorders is another area that we work in quite a bit. And then many times we would be consultants for healthcare facilities or for school systems. In my case, for instance, I have been a consultant for several long-term care facilities in the past, and I have also been a consultant for school systems. I have a contract now with 4 different school systems in the region, and so to work with them on developing their menus is a real exciting thing as well. Some dietitians go into sales and marketing, sales of nutritional products, formulas, either adult nutritional formulas or pediatric formulas, either one. But there's a lot of interest in that. Then also management positions. When you think about a hospital or a long-term care food service operation, there's usually a registered dietitian who is in charge of that entire department, makes all the decisions as far as the way the department is going to be managed and operated, the hiring decisions, the menu decisions, the tray service, meal service to the patients, and that sort of thing. So all of those decisions, then that is a whole nother area for registered dietitians to be employed in. And then, of course, there's the higher education, nutrition education and research, teaching, and that sort of thing. And like I said, wellness and sports nutrition are just huge opportunities now, more and more important for dietitians to work in those areas. Now, there are some students who are really not completely interested in or completely committed to becoming a registered dietitian. Part of that is because they would have to go on to graduate school. That's just not an interest or something that they can do at the time. So there is an option for those that don't want to go on, and that's called the dietetic technician, and that's also a registered position. So it's a DTR, which stands for Dietetic Technician Registered. The dietetic technician registered is someone who works alongside the registered dietitian and does similar functions, but not as complex. And so they would be more of a diet tech sort of a person, and they would work to do nutrition assessments, some basic nutrition education. They work primarily in the hospital setting, and many times they're working in a management setting as well within the hospital. These folks can also be WIC, nutrition educators for the WIC program, the Women, Infants, and Children program, and they can become lactation consultants. They can work with agriculture extension services. They can be food service directors. They can actually direct an entire food service operation. And we've had several students that have gone on and done this, and they're very happy with it because they're just not interested in graduate school. So that's always an option as well. Now, as far as The financial aid and that sort of thing, there's lots of options for financial aid within the university, and then there's options for graduate assistantships and tuition scholarships once a student is admitted to the internship program here and the graduate program. So there's many options that are available for students while they are in the graduate program as well. A lot of students have questions about salaries in various fields, and so the salary range for nutrition and dietetics for the registered dietitian generally starts out around $45,000 a year, sometimes a little bit higher than that, but that's for entry-level positions, 40 to 45, and then they bump up very quickly in a short period of time. So the average for the first 2 to 3 years of employment is between $45,000 and $50,000, and then up from there. So it is a good pay level starting out. The dietetic technician registered is a little bit lower because it's a diet tech position, and those folks are not credentialed as an RD, and they also don't have a master's degree. So they would start out more around the $35,000 range. But depending on what their job position is, if they're a department manager, for instance, then they could bump up very quickly as well. And within the VA system, for instance, those positions as well as the RD positions are much higher. So it depends on what position you attain, what part of the country you're interested in, because some parts of the country pay more, certain positions pay more, certain companies pay more. So there's a lot of variables there, but it's for the diet techs it's starting around $35,000, and for the RD it's starting around $45,000 generally. Now, if you're interested in changing your major into dietetics or nutrition, I would be happy to speak with you about that. You can contact me through my email address is usually the best way. Telephone is just not too reliable because of either I'm not in the office or when I return your call, I can't get you or whatever. So if you want to contact me through email, you can. My email address is shown on the slide, and my office phone number is there as well. So if I'm not in the office, you can leave a message. But email contact is very effective. And I'm located in Hutchison Hall, right on campus, right next door to Lamb Hall. So easy to find me there. So I'd be happy to speak with you whenever you need to.